So you just finished braces and your orthodontist gives you a retainer and says you have to wear this every day for the rest of your life. Most people hear that and say, that can't actually be necessary, right? Trust me, I warn my patients at the treatment plan presentation before even starting braces, and they still look at me like I'm crazy. But the truth is, your teeth are naturally trying to move back. So in this video, I'm gonna explain why retainers are necessary, the different types of retainers, and which ones I actually think are the best. What's going on, everybody? My name is Dr. Eli, and I'm a first-year orthodontics resident. Last year, I graduated from Boston University, Henry M. Goldman School of Dental Medicine, and this is my YouTube channel. On this channel, I make vlogs of my residency journey as well as my dental school journey, and I also make videos for the public that help inform you all on different dental topics. I find it super important to make videos like this on the internet because that's where people get all the information. And usually people are quick to do a Google search on information they're looking for and not so quick to ask a dentist because they feel intimidated, they may have white coat syndrome, etc. So here I am on the internet bringing the information straight to you from a trusted source. So like I said, I'm a first year orthodontics resident, and it's so often that my patients will ask, why do I need a retainer? Or they'll make comments like, I just wore these braces for 2 years and now you're telling me I still have to wear this thing every day. But I feel like people don't truly understand why we're asking them to wear their retainers. So in this video, I'm gonna explain it. So first thing we're gonna talk about is a concept called relapse. This is when your teeth are trying to move back to their original positions after we take the braces off. So your teeth sit in elastic fibers, which are part of your periodontal ligament. Think about it as your sock. Your foot sits in a sock. When your sock is in your shoe, it doesn't slide around so much when you're running. But you take your shoe off and you start running with just your socks, and next thing you know, you turn and look down, and the part of your Nike sock that says dry fit is all of a sudden under your foot where it should be on top of your foot. Think about it like that. So when we put braces on your teeth, braces are actually stretching the fibers that are surrounding your teeth and holding them in place. And these fibers are trying to reorganize when we move the teeth into a new position. But it takes the fibers a really long time. So when we take the braces off, they naturally are acting like rubber bands trying to move them back. And as we're moving the teeth and these fibers, the bone around them is remodeling. And so that takes a long time as well. Not only that, you got to think about when most people get braces in their teenage years, right? So for me, I got braces when I was 13 years old and I got them off when I was 15. As a boy, that's like prime puberty. I'm growing a lot. I go from 5'7" to 6'2". Well, I wasn't 6'2" when I was 15. I was like 5'10". But still, you're growing a lot and your face changes along with that. So you get growth of your mandible, which is your lower jaw. You get growth of the maxilla, your upper jaw, your face, everything. There's constant changes going on with your body. On top of that, braces are putting a force on your teeth to cause them to move. But when we take braces off, there are still forces acting on your teeth. You got the force from your tongue that are pushing your teeth outward. You got the force from your lips and cheek that are pushing them back in. And it's a constant tug of war between your tongue and your lips and cheek to keep your teeth in one specific place. This is especially important because this is actually what puts your teeth in their original position. So when we take the braces off, the tongue, cheek, and lips are actually trying to push the teeth back to whatever they felt like was most comfortable for them, which is what your teeth were before you had braces on. So you gotta think about all these different things that are going on inside your mouth. When we take our appliance out, which is the braces, all these other things are still acting on your teeth, so you have to have something there to hold them in place. Quick intermission to the video. If you're watching the video and you've made it this far and you're enjoying the content, please drop a like on the video. It's right here under the video. Just click the little thumbs up button. It's of no cost to you, and it does so much to help boost the video and the channel in the YouTube algorithm. Thank you so much, and I hope you enjoy the rest of the video. So now let's talk about some of the main types of retainers that you may see when you are a patient or maybe your kid is having treatment. Number one, probably the most popular, is the Essex retainer. Those are the clear retainers that look like an Invisalign tray that you can't really see. Those are probably the most popular because they're the easiest to get the patient to wear because they are pretty invisible, and it still helps the patient feel like they have that nice clean smile with no braces, even though they do have something holding their teeth. That's why Invisalign has become so popular in the last 20 years. These retainers are also great because they are relatively cheap to replace and they're pretty comfortable for the patient. However, the cons are they crack easily, they stain easily. If you don't take good care of them, they can look pretty nasty pretty quick. Trust me, if you're looking for a funny video to watch, I actually made myself a new retainer when I was a second-year dental student. And if you go to that video, you can just see how nasty my original retainer got. Kind of embarrassing, to be honest. Next retainer we'll talk about are the Hawley retainers. Now, these are the retainers that have the wire in the front and they're clear or pink on the back, and honestly, they're not the most aesthetic thing, but they do a great job at holding teeth in place. Now, one thing orthodontists really like about these retainers are they are adjustable. So if you feel like they're not doing a great job, you can go back to your orthodontist and they can tighten them relatively quickly. They're also a little more durable than the clear retainers, and they also have great benefits to them, like allowing the bite to settle when you're finished with treatment. But the bad thing is they're kind of bulky. They have the wires, so they're very noticeable and look very similar to your braces. And as a result, people won't really wear them because they feel like they still have braces on. Now, the third one we'll talk about are bonded retainers. These are one of my favorites. A lot of people know them as permanent retainers, but I've been trained not to call them permanent because truly they are not permanent. They can always break, they can always come out. Your orthodontist might take it out, so it is not permanent. However, it's great because you don't have to think about taking it in and out. It's a small wire that goes behind your teeth. I have one on the top because I used to have a gap. I think it's one of the best ways to keep the teeth together after having a gap and having braces. The bad part about them is they are hard to floss behind. They can break, and they're really only intended for the front teeth. So personally, I still have a clear retainer that I wear over them, and you have to wear that when you have a permanent retainer. So if you ask me which retainer I think is best, I think whatever retainer the patient will wear the most often is best. Now, most people would think that means the bonded retainer, but actually, I think Essex retainers are the best. Reason being because patients will wear them. They won't cause emergencies in the office when they break like a bonded retainer would. And as we move into the digital age where people are doing digital scans rather than analog impressions and putting that gunk all in your mouth, your orthodontist can keep your digital scan forever. And if they have the technology to, they can just print out a new retainer for you that will be just like the day you got your braces off, even if you're 5 years out of treatment. So that's why I'm a huge fan of Essex retainers. Now let's talk about what happens if you don't wear your retainer. Now, the first thing that happens, minor shifting. You may be able to fix this by putting your retainer back in, but it'll feel very tight and uncomfortable. However, if you can put your retainer back in and seat it down all the way, you're probably good to go. But next thing, if you continue not to wear your retainer, you will have visible crowding or spacing that comes back. This is relapse. It will get to the point where putting your retainer back in will not fix the problem, and you'll have to go see your orthodontist to get a better solution. Now, this can be fixed without having braces again. Something new that I learned when I was in residency is that you can make active retainers that could push a tooth or two back into place. But eventually you may get to the point where you can't use that either, and you have to go to the next stage, which is having braces or Invisalign all over again. That's the stage that I got to. Now, is it all bad? Well, maybe not. Maybe it'll lead you to finding a natural interest in teeth, and eventually you'll become a dentist and one day an orthodontist like me. However, it kind of sucks because if you have parents like mine, they're only paying for braces one time. The next time it's all on you. So you should wear that retainer. Now, typically we ask people to wear their retainers all day and night for the first 6 months. This is because it actually takes about 6 months for those fibers that I was talking about to fully settle in their new position and not want to bring your teeth back to how they were when you had your original teeth before braces. Afterwards, we still recommend that you wear it at night for as long as you want to keep your teeth in that position. However, you will probably be able to get away with wearing it less and less at night as time goes on. Like I said, your teeth never really stop moving. You continue to grow, and studies actually show that your lower jaw will continue to grow for the rest of your life. This is actually why people start to have crowding in their older age. It's not because your wisdom teeth are pushing your teeth together. It's actually because of late mandibular growth. So if you had braces before, be honest, leave a comment. Do you wear your retainer every night? I'll be honest with you, I don't, but I try to get it in at least once a week, and that keeps me good enough for where I'm happy. If you want more videos about orthodontic topics like this, leave a comment below and let me know. That's all I have. Thank you all for watching. I hope you found this video informative, and I'll see y'all in the next one. Peace. I told her she gotta run to the team before she can talk to the lit. Before she can talk to the jet. Lamb chop, I just pulled up in some